About pediatric surgery. The topics are neonatal obstruction, inguinal swelling, pediatric GIT bleeding, surgery respiratory distress, pediatric urology, umbilicus neck swellings, and biliary atresia. So, what is neonatal obstruction? So, this is about obstructions CHPS, congenital hypertrophic pyloric stenosis. The age is 2 to 6 weeks. More common in males. Symptoms: forceful projectile non-bilious is important, oleucine is important, palpable mass, failure to thrive. These are the important top points. Differential diagnosis is GERD, first 2 years maintained bilious. So this is non-bilious. Ultrasonography, more than 4 mm thickness is there, barium meal, hypokalemia. This is important, hypokalemia. Potassium is less, chloride is less, alkalosis is there, AKL, and aciduria, paradoxical aciduria. Then resuscitation with saline. This is the first, and correction of the electrolytes, rise tube insertion, Ramstead surgery. This is the question, this is the question, this is the question. So this was about neonatal obstruction. Then second is important is day one, just newborn. What is there? Duodenal atresia, Down syndrome, double bubble sign. Bilious vomiting is there, double bubble sign in X-ray. Question: bilious vomiting, Down syndrome, day one, duodenal atresia. Resuscitation, duodenostomy. Mucinum ileus, neonate, and cystic fibrosis. This is question. How does it CFTR gene, chromosome 7, cystic 7, regulate the movement of chlorides, sweat chlorides. Thick mucinum plug which is obstructing this site. Plug is obstructing. Soap bubble. Here it is soap bubble. It is non-operative. Acetylcysteine enema is given. If patient has got obstruction, then you have to go for ileostomy. Hirschsprung is neonate to any age. Males are more common. Down syndrome again. Failure to migration of neural cells. Abdominal distension early. There is distension of abdomen. Delayed passage of mucinum. Again, this is there. Gush of the stool on PR. If you get this catch point, then you go for the rectal biopsy is the question. 2 cm above the dental line. Allorectal myometry. No allorectal flex. Operation is pull through operation. This is the question. So this dilated bowel is normal and constricted is abnormal. Aganglionic. What are inguinal swellings? Indirect inguinal hernia. Patent processus vaginalis. From there swelling appears. It is non-translucent. Herniotomy via inguinalus. Hydrocele of the cord. Process vaginalis. In between there is transmission there. Swelling separable from the testes. Operation inside incision. 1 to 2 years of age. Hernia should be operated as early next few days because it has caused risk of obstruction. And vaginal hydrocele fluid is in the tunica vaginalis. This is the question. Tunica vaginalis. There is scrotal swelling with transillumination is positive. 1 to 2 years of age. You can wait till retractile testis. Cremastic reflex is exaggerated. Testis presence as in bath elevate. This is the question. Retractile testis. Follow up every 6 months. Then go for laparoscopy. Ectopic testis. This is another question. Ectopic gubernaculum is important. Outside the normal pathway, superficial inguinal pouch is the question. This word, orchiopexy at 6 months. So next is undescended testis. It is because of hormones inside the normal pathway, abdominal, scrotum, anywhere. Orchiopexy at 6 months. Then Morgagni cyst. Testis appendages, sudden onset of scrotal pain, black spot on the testis. This is conservative management with analgesic. Explore and remove the cyst. This again is coming. Torsion of the testis. Sudden severe scrotal pain higher than the normal. Urgent exploration is the question and answer. Testis is gangrenous, orchiopexy, testis explosion. Now, pediatric GIT bleeding. What are the causes of bleeding? Necrotizing enterocolitis 10 to 14 days preterm. So GIT bleeding and malrotation also there is. Bilious vomiting is there, abdominal distension, bleeding per rectum. X-ray shows pneumoperitoneum and acidosis, increased TLC, all the counts are increased, diastole, nutrition, pneumoperitoneum, LATS operation. No, this is for the malrotation. At 1 year, excess superior mesenteric artery, intermittent bilious vomiting, on and off obstruction, upper abdominal distension, may cause complete volvulus and barium will follow through or CT abdomen. LATS operation is anticlockwise rotation. This is question. Resection, anastomosis, LATS band to be divided, wide root mesentery, small appendectomy. Appendectomy has to be done. Now bleeding per rectum continued even in interception 6 months to 2 years. So you get screaming. This is the catchword. Diagnosis confirmed on ultrasound. Primary interception, no definite cause. Primary interception, secondary. There can be secondary or primary. In primary, this no definite cause may be viral infection or mesenteric lymphadenitis. Secondary, there is either Meckel's diverticulum, lymphoma, lipoma, or any other. So this is the clear-cut cause. Primary is just an infection of viruses, lymphadenitis. 6 months to 2 years. Most common is ileocolic is most common. Treatment is reduction with air insufflation. Pneumatic reduction can be tried. If it is failed, surgery is to be done. History of then anal fissure, age, history of bright red, rectal pain, defecation, juvenile polyps, higher age, patient notice post defecation, bright red color, fleshy mass. Congenital due to incomplete of then what is there? Meckel's diverticulum. What is there over 2 years? It has no abdominal pain or indication. Congenital due to incomplete obstruction of proximal white-low intestinal. Proximal vital intestinal duct. It has a rule of 2% population, 2-inch long, 60 centimeter from IC wall, or this is the question, 60 centimeter vital intestinal duct, incomplete obturation of vital intestinal duct, true diverticulum, all 3 layers, pancreatic mucosa, this is the question, gastric and pancreatic mucosa can be there. Blood supply, this is again vital intestinal artery, which is a branch of superior mesenteric artery. This one is the question. Normal asymptomatic and present abdominal pain, removal, wedge resection, all that. Intermittent bowel disease, 10 years, weight loss. Now about respiratory distress. This is respiratory problem. Esophageal atresia. There are different types. Proximal atresia with distal fistula. Proximal atresia with the distal fistula. This is trachea and this is esophagus. So here you put the rice tube, defect in the pleura. So what is there? It has associated bacterial anomalies, imperforate anus and all that, detect early. Continuous salivation is there, cough, choking, rice tube cannot advance in the X-ray, right thoracotomy, closure of the fistula. The congenital diaphragmatic bulk dilate, the question is again and again coming, pleuroperitoneal membrane, left posterior, most common 85%. This is septum transverse morgagni and associated with the cardiac anomalies. Detected early respiratory cyanosis, X-ray, decrease air entry on the left side of the chest. There can be scaphoid abdomen, chest X-ray contrast abdominal lesion. So differential choanal atresia, this is another DD present with recurrent episode of cyanosis. Cyanosis was during feeding. Cyanosis was during feeding is choanal atresia. GERD, there is also one question present with omit some milk, recurrent pneumonia increased by lying flat. H-type TOF, destroyed pediatric urology, balanitis, inflammation of the glans penis, prosthesis, inflammation of foreskin, phimosis. Secondary to balanitis may cause circumcision is required at the age of 16 years. You have to wait for 16 years, phimosis sometimes. Now, retraction glans may allow, that is paraphimosis. Vesicular reflex, backflow, posterior urethral walls, again vesicular obstruction for the pelvic junction obstruction, dilatation of renal pelvis and hydronephrosis, PUJ obstruction. Umbilical anomalies, gastroschisis outside the abdominal wall. Bowel is outside the wall, located right side. This is the right side, no sac covering is there. This is the question. Gastroschisis, no sac covering. Exophilus, connected to the umbilical cord, there is Other cardiac and conservative management corrected. Bowel covered with the sac. Exomphalus. Umbilical hernia, strangulation is rare most of the time, conservative up to 3 years, then surgery at the age of 3 years, open absorbable sutures. Paramedical defect in the linea alba, means umbilical granuloma. This consists of cherry granular umbilical lesion. Patent urachus, yellowish fluid. Patent vital structure, brownish fluid. These are the questions. Pediatric neck swellings. Again, this is important. Posterior triangular neck, posterior triangle, cystic hygroma behind, branchial cyst anterior. This is posterior. Adolescent age, branchial fistula again of the second branchial cleft, mucus discharge, thyroglossal cyst and dermoid. Thyroglossal cyst swelling between strap muscles, elevating protrusion of the tongue. This is important, protrusion of the tongue and swallowing. Most common complication is recurrent inflammation. This is question, recurrent inflammation, protrusion, thyroglossal cyst, midline swelling, suprahyoid, not elevated by. So dermoid is above and this is subhyoid. Thyroglossal is below. Hyoid bone. Dermoid is above hyoid. Dermoid is above. So what about biliary atresia? Persistent jaundice more than 14 days. Conjugated bilirubin is increased. Roux-en-Y portogenostomy. Kasai procedure is also there. This is the question. This is the question. This is the question.